Once again, here comes Medicaid expansion being proposed for the state of Wyoming because there are certain people who just won't let it go, and they just keep throwing it out there. They're going to keep throwing it out there till they get it. So when I read a story, and I think Doug does a good job at trying to show both sides of the story, but he really doesn't get into detail because I don't think Doug knows any doctors out there or people who work in hospitals. The details, the down and dirty details, is why you don't expand Medicare in the state of Wyoming. So if I'm going to bring up this topic, here comes Dr. John Mansell from Gillette, Wyoming. So let's start with the hospitals, John. Expanding Medicaid would be bad for Wyoming hospitals. Why?
Well, in the short term, the hospitals would want us to expand it because they're getting some money for some patients who currently don't pay them anything. The downside of that, though, is the program encourages people to either have jobs that don't have health care insurance or move to your state because all they have to do is announce their intent to move to your state in the next 6 weeks to get on your Medicaid program and show that they don't have the wherewithal to pay for it.
So the 27,000 people that they're talking about would end up becoming much more than that.
Well, in every other state, historically, all the estimates of what they thought they were going to put on were grossly underestimated.
Okay. Isn't there a problem in some other states like Illinois with medical tourism? People coming in basically for free?
Well, and one of the things we'll see is some perverse behavior because in Wisconsin, for example, there's an estimated 15 or 20,000 people who actually live in Pennsylvania, New York, and New Jersey who actually commute to Wisconsin for Medicaid, not because the Medicaid's different, it's just this healthcare systems in the previous three states are saturated. They can't take care of the Medicaid people. And so it's easier for people to actually drive to Wisconsin and get the care. And because we live next to Denver, that system is already saturated. So we would see a lot of Colorado people who'd want to come up and take advantage of our Medicaid. We already have half of the Medicaid recipients are in the three counties that touch the Colorado line. So we can already see that pattern emerging.
Okay, so now for the hospitals who, again, want that money up front, as you said, but does this mean that in the long run, the federal government is not providing not just enough to cover because they're being overwhelmed, but what about the other costs? Do they pay the full price of seeing a patient?
No. The national average is that Medicaid pays about 86 cents on what we call the cost dollar. So if it costs the hospital $1, Medicaid only gives them 86 cents. And so what we see is, while they may get some money today, in the long run, they're expanding the market of their patients who they lose money on. And so in the long run, hospitals tend to be more financially stressed.
Okay.
And we've seen that around the Chicago area where I used to work because people were driving 3 hours away from Chicago because there was a shorter wait time to go to a rural hospital. But what would happen is the payer mix would be so heavily Medicaid, the hospitals would basically go out of business.
Okay.
They couldn't afford to stay open.
Well, speaking of go out of business, then, let's talk about it. As a doctor with a private practice, is it good for a doctor with a private practice or bad? Because I read story after story about doctors who are just saying, I'm not accepting Medicaid anymore.
Well, it's really ironic because I talk to all the physicians in my county because I'm one of my jobs is to find out what their opinion is politically, and even the doctors who want to accept Medicaid because none of us wants to decline someone's care. And one of the biggest worries we have is Medicaid is critically important for so many patients who literally can do nothing for themselves. And our worry is that if we expand the program and break it, those people are left with nothing. But even the doctors I know, especially pediatricians, who want to see Medicaid, they have faced the fact that they can't because they basically lose money on every visit.
Okay, so let's go through, because I know that it's very similar to the hospitals, but let's go through why would a doctor lose money seeing one of these patients?
Well, usually because the reimbursement from Medicaid is not enough to cover your office expense. And, we pay rent, we have to pay our employees, we have to pay for health care insurance for our employees, we pay malpractice insurance, there's all the normal office costs, paper, computers, and all that kind of stuff. And Medicaid, for the most part, doesn't cover the cost of providing the care. So there's nothing left over, and frequently there's not enough paid to even cover the cost of your employees in your office when you see a Medicaid recipient, which is, again, not a knock on the Medicaid recipient, and it's not a knock on Medicaid. It's just that over the decades, we've spread Medicaid so thin, the way legislatures have dealt with it in other states, and hopefully not in this state, is they have to keep lowering the reimbursement rate. And as it lowers, there are fewer and fewer people who can afford to see them, and fewer hospitals. Although the hospitals are required by law to see Medicare and Medicaid recipients, in the long run, what we've seen is hospitals become stressed financially, and we're going to see more rural hospitals go out of business, and of course that's the majority of hospitals in the state of Wyoming.
Okay, so it seems to me when I read a story, let's say out of Montana, Montana received $400 million. Okay, that was the money going in, but I don't see a report on how much it costs to take care of those patients. So it may have been a cost that's higher than what they received from the federal government. Is that right?
That is right. And what's ironic is that Medicaid originally had its biggest customer base was in inner cities, and there's a formula for Medicare and Medicaid on how much you get paid by region. So inner city hospitals and inner city providers, it was assumed that they had a higher cost of doing business, so they would get paid more. Whereas in rural America, where the cost of real estate and rent and everything is less, and labor is slightly less expensive in some places, they actually pay us even less in rural America, which exacerbates the problem.
Okay. And I do recall covering some stories over the past few years that there's a few doctors around the state of Wyoming who finally just said, I'm not accepting Medicaid anymore. I'm going to go to some other system, maybe just cash only. I'm just not going to do this. I mean, and
that has happened, and I will tell you that the providers are not happy that they had to do it. No one is gleeful about not being able to take care of a patient.
Right.
It's just they've come to the point where it will break them. If they go out of business, then they take care of no patients.
Okay.
And so that being the case, that's the choice they face. I can take care of no patients and continue taking Medicaid, or I can not take it and still take care of patients.
I'm going to ask you to speculate then, because as many times as we've had this conversation in the state of Wyoming, there are those who just keep bringing it up. And when I offer them someone like you, and you're not the only doctor who's told me this, and I offer them, well, listen to what this doctor said, listen to what this hospital says, why aren't they listening?
That's a great question, because what was Einstein's definition of insanity?
Yeah.
Keep trying to do the same thing over and over again and expect a different outcome. I really can't tell you why they feel that way, other than dogmatically some people think Medicaid's great, and I will tell you, for those patients who need it, and the best example is if I've got someone who's had a stroke or cerebral palsy and they literally cannot take care of any of their 5 activities of daily living, those people obviously need this safety net. And there are various people who are involuntarily stuck where they are in life, and they need Medicaid. But when we start making Medicaid an elective choice for able-bodied adults, or for people who just elect not to get married and be single-parent homes, that's when we start diluting the program so badly we worry we're going to break
an overwhelming system. John, thanks for the call. I appreciate your time. Dr. John Mansell is calling from up in Gillette, Wyoming, coming up on some local news. And we'll have a look at your weather forecast. 7:45, Don Day with Day Weather joins us to go through today's forecast, which is a bit mixed. Another front moving through the area. 7:29, temperatures upper 20s, lower 30s. Wake up, Wyoming.